Okay, we've reached our last talk of the day, which is, I'm very pleased to welcome Dr. Arthur Caplan to speak to us. Dr. Caplan is a distinguished bioethicist who's currently the Drs. William F. and Virginia Connolly Mitty Professor and founding head of the Division of Bioethics at New York University Langone Medical Center. He was formerly Professor of Bioethics at the Perelman School of Medicine at University of Pennsylvania, where he created the Center for Bioethics and the Department of Medical Ethics. He's the author or editor of 32 books and over 600 papers in peer-reviewed journals. He's also a frequent media commentator, as you well know. He's served on numerous highly influential national and international committees and received many awards and honors, too numerous to mention. But I will just mention one of them, which is that in 2014, he was selected to receive the Public Service Award from the National Science Foundation National Science Board for substantial contributions to increasing public understanding of science and engineering in the United States. He holds 7 honorary degrees from colleges and medical schools and is a fellow of the Hastings Center, the New York Academy of Medicine, the College of Physicians of Philadelphia, the American College of Legal Medicine, and the American Association for the Advancement of Science. Thank you very much.
That I stand between you and dinner, you and the weekend. So I will not talk for more than 90 minutes. Presentations have been fascinating, and what I'm going to try to do is tell you a little bit about a case that I encountered some time back. Some of you will know about it. It shapes my thinking about what some of the risk factors are for neurological genetic testing, where families might be nervous. I'm going to be focused on kids, testing of children, and testing of fetuses and embryos. I'm going to use, after I tell you a little bit about this case, the example of Down syndrome, which is old, but one of my favorites because it also leads to some interesting ethical questions about what's likely to happen as testing becomes more widely available. A lot of folks, I think, soon will not be getting their testing with a counselor who's a genetic counselor or in a program of human genetics. They will get it elsewhere. And if I have time, I'll give you one elsewhere, which is CVS, which just ran a test yesterday, June 4th, Wednesday, of people for detection of memory disorders with a hint toward Alzheimer's with a written exam given by the pharmacist. And that's a kind of a testing for neurological disorders, not genetic, but it's interesting because it wouldn't take much to add in a little spit and kind of see where you were going from that point on. So I think the world of genetic testing is changing, and as we begin to expand our understanding of neurological conditions, psychiatric conditions, mental health conditions, there are going to be some very interesting dilemmas and challenges. So as I said, I'm going to take a look at fetuses and children, a little bit on mass screening at the end, with time permitting. So this was the case. Some of you may know about it. I've written about it. It has always bothered me. It took place at an institution I don't want to name, but it's 99 miles south of here. And it involved BRCA 1 and 2 testing for a young girl at 12. Her family had lots and lots of early onset breast cancer, and her father brought her in for genetic testing. Very domineering man. I met him, talked to him. Very worried, very loving and concerned about his daughter, but he had seen too many in his family, and this is more or less a quote, a paraphrase, die from breast cancer at too young an age. And he felt that he wanted to do everything he could to prevent this from happening to his daughter. He also felt a great deal of guilt, which we haven't said much about maybe that he had passed on this risk to his daughter. And I think by preventing this, he would feel better in terms of the guilt that he felt. about putting her potentially at risk. So he said, would you test her? Well, that's not quite true. He said, you must test her. That's how I got involved. And basically, it was funny because most of the time I'd been involved was around the Myriad lawsuit and whether we were going to test anyway without paying fees. But this was a clinical case where everybody was very nervous about the wisdom of testing this 12-year-old at the demand of the dad. So there were some pros. Obviously, a negative test would make everybody feel better, and that would be good. And the dad was seen to be the legitimate, loving surrogate for the daughter, trying to do something that would protect her. There wasn't a lot of discussion of whether BRCA 1 and 2 testing fell into an area like reproductive decision-making, where there's more discretion given to the younger person to decide, do they want contraception, would they want to seek abortion, where they may have more standing when the decision is reproductive. People didn't think that was appropriate. They thought the dad was her parent, was her decision maker. On the cons, it was pretty clear what this guy planned. He was going to remove her breast buds. And he wanted to stop this risk from happening, and that's what he said he would be doing. So there was mutilating surgery. Many felt, and I did too, why shouldn't this girl decide for herself? Nothing is impending. There's no problem right now that she faces. She could decide later to whether she wanted to get herself tested. And then there was a little bit of a false sense of security about breast cancer, because yes, it is true this family had breast cancer risk, but as many of you in the room know, if she lived downwind from a toxic chemical plant, smoked 4 packs a day, and got very heavy, she'd have breast cancer risks of a different sort. So you could rule out a particular threat, but not necessarily rule out everything that was threatening to her just by genes or this particular set of mutations alone. Well, we decided not to test, and we explained why. We gave a couple of ethical, or I gave a couple of ethical principles. We would do no harm, not going to harm her, not going to put her through any kind of surgery. There's no need yet. This can all wait till a later time. We said, yes, we know you're her dad, but the girl still really seems to us to be the patient, and so she'll get to make the decision. There's nothing, again, pressing about this. She can decide this full well without causing her any additional risk or harm later. He took his daughter somewhere else, testing got done, and I know that the breast buds were removed. I don't know if they took out her ovaries as well. I don't know. There's a lot of folks out there who, whatever the ethical standards are when it comes to genetic testing and acting, will do what parents say, will do where things that might be done in order to make some money, will do things that might be done because they too feel that these risks are big and perhaps they agree. So, was this other place ever condemned or criticized or held to account or debated about? Not to my knowledge. So nothing has happened within the field when we see instances like this, and I find that troubling. But it also troubled me that this particular dad was so very worried about breast cancer. Let's look at some other genetic tests that are just appearing now or in the works. At least we're testing mice and rats, and they seem to have markers for certain types of dopamine or other uptake, metabolism type of biochemical phenomena. So there's risk out there to determine if you're likely to become a nicotine fiend, a cocaine addict, or a heroin addict. They'll be here soon, coming soon to your local genetic testing environment. There are certainly people who think they can find the genetic basis of antisocial behavior. I think that's likely to be kind of multifaceted, but all right. Maybe there will be somebody who still hangs out a shingle and says, you know, we've been through the era of XYY. We saw it once, it could come back again. It is true that you could also just test for males if you're interested in antisocial behavior, so that's another genetic test. You could do that and offer that. I think it's likely that we will find some markers for homosexuality. And I think that some in the gay community think that would be great because it would finally show a biological basis, not some kind of volition or over-stifling parents or something else. I'm not sure how great it will be, because just as that dad who was trying to do the right thing and was very worried about passing on a risk, how many parents out there that we know who are signing their kids up to make sure they get to the right kindergarten in Manhattan so that they can attend Columbia someday, certainly wouldn't really be slumming around NYU, keep their kid under severe isolation if they found out that they were at risk of becoming a drug addict, higher risk. Watch them all the time, watch them like a hawk, don't let them go to parties, don't let them do anything. There's even a weird argument here that goes, shouldn't you get to try drugs to see whether or not you want to have that experience, even as a kid? It's been tried on me by certain offspring of mine, wise guys. And I'm not a person who was a big drug user in college, so I didn't have that problem about what I did and what they did. So, it's still, the argument was there. How many parents think about the people you eat Thanksgiving with or have holidays with at different times would say, my child's at risk of homosexuality. I think I'll try to make sure there are a lot of Army men around. We have a lot of football on TV all the time, and we're going to really do the masculine thing. Or might even say, I'm going to set out to deprogram them, whatever way that might take. I can imagine a lot of interventions when the issue is mental health to try and be proactive that well-intended, and I'm going to describe that dad with the daughter as at least loving and trying to do the right thing. I don't think we gave him the kind of counseling he needed, but nonetheless, when you're in this sphere of neurological, it is likely that you are talking about matters that parents are going to have very, very strong feelings about when it comes to their kids, and it wouldn't surprise me if the demands to test, should any of these things come to fruition, are going to be exceedingly strong, and that there will be a large number of people who will offer these tests, even perhaps when they're not that sensitive or specific. So let me swing out of that case and then tell you a little about Down syndrome, just to remind you. This is a grand old disease and which has a strong neurological component. We've been testing it for a long time, and it has interesting ethical things to think about as a lesson going forward. It's the most commonly occurring chromosomal condition. A lot of babies are born in the US with Down syndrome, or conceived that have Down syndrome. There are 400,000 people with Down syndrome in the US now. All people with Down syndrome experience cognitive delays, but the effect is usually mild to moderate and is not indicative of the many strengths and talents that each individual possesses. That's in blue because that phrase came from the Downs Association. The first two are just facts. The last one is on the Downs page, is how they see people with Downs. You can get other descriptions of Down, but that's one that many people adhere to who have Down's children and who fight for resources and opportunity for people with Down. It's the Down syndrome facts thing on the bottom there. Just recently I came across a mom, Tara McCollin, who has a child with Down, and she says on her website, I want the world to see beauty in being different. This was just this week I came across her, and she had a hard time accepting the fact that she had a child with Down that was different. She grieved a lot about this in ways that some of us know sometimes parents do that have children with various types of disability. But what she came around to think was that this child was a gift, and she started an online site called the Happy Soul Project. She blogs about her child, her daughter, and tries to get others to think about stigma, biases, presumptions, preconceptions. And she feels very proud that she has found a kind of redemption from her initial worries and perhaps even distancing from her newborn daughter. She now has got her on a billboard, a 200-foot billboard in Toronto that boasts about her child at one of the busiest intersections in Toronto. There's her kid, and there's the billboard behind them. I don't know where that kid got those glasses. I'd be worried about that, but that's a separate problem. And there she is again. What makes you different is what makes you beautiful. So that's a view of Down. It's not a view that everybody holds. American College of Obstetrics and Gynecology, ACOG, recommends that everybody be offered screening tests and diagnostic tests for Down syndrome. That's been around for a couple of years now. All pregnant women, and it is not age-based. Used to be over 35, not anymore, everybody. So there are two kinds of tests. In the interest of time, I'm not going to go through them. You can see them there. The first is a set of biochemical tests that screens the mom for chemicals floating around in her that basically might reveal the presence of an infant with a fetus with Downs, although interesting enough on all the ACOG sites, it's always baby. It's never a fetus. The last test, the newest one, is the cell-free DNA test, which tries to pick up floating DNA from the fetus out of the mother's bloodstream, moving fast, coming very soon to an OBGYN next to you. Anybody who doesn't think cell-free DNA testing is going to become standard of care, if for no reason other than malpractice, really soon is not paying attention. That will be the way most women find out about what's going on genetically with their fetus. It's going to be through routine screening. ACOG has moved to Down's recommendation for everybody. Cell-free DNA testing is going to be standard of care for everybody. That means that whereas you used to have a whole parade of things happen, amniocentesis and chorionic villus and a lot of genetic counselors, and let's wait 3 weeks to know, and we'll think about it further, although we're not going to direct you in any way, but we'll be thoughtful about how we go through all this. 2, it will be your OB who's going to be doing the information. And following up on the previous panel, here's what OBs do. If you came in overweight, forget about Huntington's, but if you showed up and you were obese, they would say, I think you're overweight. And you would say, I don't want to know. And they would say, you will lose weight, and you will do it this way. And if you don't do that, we're going to have you in here every day and put you on the scale, and you're not going to get gestational diabetes, and this is unacceptable behavior. They are as directive as can be. You couldn't not know. You couldn't control anything. By the way, side note, pediatricians, I don't want to vaccinate, it's my choice. I don't vaccinate myself, I don't vaccinate my kid. Great, I'm not your doctor. End of discussion. So the notion that physicians won't be A, directive about reproductive stuff, B, won't set limits on what they're willing to do in a practice. I was wondering what that, if the doc had said to the Huntington's case person, you don't have to know what these symptoms mean, but I don't have to be your doctor. Or if I have a contract that says anybody who sees me, you have to accept whatever I tell you are your risks. We're going to have a full disclosure thing. That's how I practice. And if I get a few more cases of people saying, I don't want to know about this and I want to know about that, then I'll just put these contracts into place because that's how I want to practice. That could be more the future, particularly with the spread of tests out from I have to go to a specialized place to do it with specialized people to I'm going to do it with more primary care people. Diagnostic tests are the ones that test the fetus or the embryo. That's they literally pulling some DNA out of them. Obviously, cell-free DNA analysis, although ACOG listed as a screening test, is leaking toward a diagnostic test. You're just getting the DNA fast out of the kid because it's starting to be extractable and clonable from circulating bloodstream. So this is just describing the test, but we don't have to get into that now. Results of neurological genetic testing for Down syndrome, which, according to many, is a mild to moderately impairing genetic condition. This article just ran not too long ago in the Archives of Diseases of Children. With new prenatal testing, will babies with Down syndrome slowly disappear? And here's some facts. 9 out of 10 babies aborted following the prenatal diagnosis of Down syndrome. This particular genetic diagnosis of a neurological condition produces 90% termination of pregnancies. The birth rate for Downs should be going up because when people delay childbearing, the older you are, there still is a higher risk factor having a kid with Downs. Best estimates that I can find are that it should have increased probably about 25%. It has actually decreased 15% from 89 to 2005. So that idea of what's going to be the point of the testing is clearly at work with Down in terms of not only diminishing, if not eliminating kids with Down. It is against a backdrop where the incidence of the condition should be going up. We should see more Down kids around if we weren't testing. This is from the UK, similar data. There, 93% of pregnancies end or terminated when Down is detected. What I don't know and have no idea is who says what to who. In this area, we've been pretty non-directive for a long, long, long time. We don't tell people it's bad, it's good, give them the information, non-directive counseling. It can't be too non-directive if you're getting 93% terminations, or there's some powerful social forces out there that maybe need some ballast. If it is non-directive counseling, I'll leave it up to you all to tell me what you think. I have my own biased ideas about this, but in any event, in the US and in the USA, a lot of folks, a lot of women choose to end their pregnancy either when they get screened or when they get diagnosed that Down is there. Again, the number of births in England should be going up, up, up. They think 48% due to delayed childbearing. They increased there only 1%. So again, this is massive elimination of people or a category of person with a neurological condition. I don't think people are ending these pregnancies because they don't like the appearance of the Downs kid. There's something going on here that says you're impaired neurologically. I don't want to deal with that. I'm not going to have that. Here's a little statement from the UN about people with disabilities. We shouldn't discriminate against people with mental or physical disability. Is screening discrimination? If we screen for homosexuality, is it discrimination or not? Antisocial behavior? I don't know. We should be respectful for difference and acceptance of persons with disabilities as part of human diversity and humanity. Do we say that to every person who comes into their OB or the genetic counseling clinic before we tell them whether or not we have a result on a Downs test? I mean, is that balance? It might be if there's 93% or 90% terminations. We should respect evolving capacities of children with disabilities and respect the right of children with disabilities to preserve their identities. Well, they don't get to preserve their identity if they're not here, or if we set out to offer testing that we know is going to have a huge impact. By the way, when I was a little guy, I remember seeing kids with Down a lot. I don't see them anymore. When I went to Ireland not too long ago, I saw them a lot. So the impact isn't the same everywhere. It's definitely culturally linked as to Britain, US moving in one direction, some other societies not, in terms of elimination of Down. So what's the bottom line on Down? Well, in my view, neurological conditions carry more freight than finding out that you might become motion impaired or that you might wind up having tremor. I think neurology in a society that values performance, capability, intellectual ability, and sees personhood very much tied into self-awareness, autonomy, loss of it, as we saw with the grandmom who didn't want to know about whether she was going to become further demented or not, and many, many people who don't want to know whether they face Huntington's disease or not. We are at the top end in our particular type of culture that values intellectual function, both for its performance and for its rooting of who we are, in a way that's very different from the detection of cystic fibrosis or many, many other diseases. These are going to be treated, well, just to say it again, I don't think you get a 93% termination of pregnancy rate unless you are now touching a particular set of capacities that people see as ultimately crucially important. We have rhetoric about disability and respect for it, and we have rhetoric that is on some of the sites of the few people who had Down's children that say they're gifts or they're happy that this child entered their life. I don't think you're going to be able to say that we got rid of the Downs children because they suffered. They're pretty happy. We might get rid of them because they suffer later when they can't live on their own, but that's a social problem, that means a housing and availability problem. It's not a inherent problem to the condition. And we've improved some of the medicine, so I think the average age for a Downs kid has gone from about 20 to about 60. So none of that stuff is really weighing in here. It's sort of following out on the I don't want to deal with someone who's intellectually impaired in certain cultures like ours. Is that the future when neurological testing comes here? Because that's where this program was this week too. It was at Rite Aid. You could get your milk and get your Alzheimer's risk factor assessment. Or if you couldn't find the milk, you could find out why by going over there. So Rite Aids across the country just this week offered free what they called memory tests from 10 a.m. to 2 p.m. I don't know what that was all about. One day, 4 hours. I'm not sure what was going on there. Maybe well, anyway, there's some bad jokes, but I'll let those go for later. And they did it with the Alzheimer's Foundation of America. And these are, I will tell you that how many of you knew that this happened this week? Yeah, the people that covered it were the business press. This came from the Long Island Business Journal. This story about mass genetic testing, oops, where is this stupid thing? Well, the other one came from the Wall Street Journal. So, and this one here, sorry, came from MarketWire, which is another business line thing. People are keenly interested in what's going to happen as more and more primary care moves to your drugstore, your dentist, outpatient settings where people can go more conveniently and where, in lieu of the fact that I know the VA has a problem getting rapid appointments, but if anybody has tried to get an appointment with a primary care doctor lately, I wish Congress would hold hearings about that. A, there aren't any. B, they're overwhelmed. C, there are not going to be many more of them soon. What's coming? That's what's coming. These guys are taking the business. They're ready to move in there and seize the opportunity. And testing, mass neurological testing, has already begun, if you will. So in an effort to spotlight the importance of the early detection of memory problems, the Alzheimer's Foundation collaborated with Rite Aid for a very narrow window, 4 hours on one day, that you could get these written screening tests. Pharmacists in 31 states and the district administered paper screenings consisting of a series of questions and tasks that took 5 to 10 minutes to do. And while the screening results are not a diagnosis, they can indicate whether someone should follow up with a primary care physician or other healthcare professional for a thorough medical evaluation. I don't know. Something's odd here. I haven't seen any quick tests for mental memory impairment that would be that predictive. My father-in-law says Sudoku does this, but that's his personal obsession. So I'm not sure I'm buying that. What I'm saying is I don't know how good these tests are. I don't know what the pharmacists were trained to do, and I sure don't know what they said if they thought somebody had not done well. Did they say, holy crap, you should go to the doctor immediately, and don't listen to that last panel. Tell everybody in your family that you're losing your marbles right away here. I don't know. Maybe they didn't. I don't know. All I'm here to say is we're running up against a series of interesting phenomena in the world of neurological genetic testing. One, it's neurological, and we care a lot about that intensely. We don't care if we're going to die of congestive heart failure or get breast cancer or cystic fibrosis, but we really care if our head isn't going to work right, or if there's going to be something embarrassing about what our kids do, antisocial, the next mass gunman, gay, all kinds of stigma and bias and many, many value issues there that just don't come up when you're just talking about the physical limits on life or morbidity. The setting of testing is shifting. It isn't the genetic counselor having intense sessions, repeat visits with the person who wants the testing. It could be your OB doing these tests routinely on every woman and getting a printout and saying, this is what the risk profile looks like neurologically for that fetus. Think about it. Or the pharmacist at the CVS saying, I did this written exam, and you spit in a cup, come back in a week, and I'll tell you if I see any other oddball markers. And then if I were you, I'd burn up my medical records, take a new name, and not let anybody know that I am losing my mind. What are we going to do about this? Well, there might be some principles, these are my last things to say, that we need to think about. Maybe no testing without consent if there's no efficacious therapy or course of action. Always controversial because a lot of things we test for now don't have courses of action. If you include, maybe I won't take on a neurosurgical residency if I flunk my memory test. I guess that's something. Could start my advanced directive sooner, something. Take out lots of life insurance, something. There may be some things you could do, but we can argue about whether or not that's enough. Removing your breast buds always seemed to me to be not efficacious therapy, did to the father. No testing without counseling from qualified counselors. I'm not sure we've ever defined what that is, but if it's coming to the primary care world or the pharmacist or the pharmacy, might be important to think about that. No testing without the certification of the accuracy of the testing. As I said, I don't know how accurate the paper exams are. I don't know, maybe they're great. I never heard anybody tell me that, but I'm certainly willing to find out that that's true and be happy. No testing unless qualified follow-up care is available. So if you go to the CVS and they tell you that you should go see somebody because your memory is really suspect, should there be a guarantee that you could do that? Or should we say we're not going to test you unless we know that you could do that? Or are we just going to leave you there saying, well, you're kind of dingy, but, good luck, run a bake sale, see if you can work your way to somebody who's an expert. No testing without reaffirming consent, an old rule from Huntington's disease days that you really want to get the results. They got them at the pharmacy pretty fast, did the test, got the results, I guess, quick, efficient. And maybe no testing without letting the person deliberate about whether they want to know the results, or let them deliberate about whether they want to take the test. If it's routine as part of women's screening in obstetrics, there's not going to be a whole lot of deliberation. There's just going to be information moving out about a huge range of conditions. The response to Down, and I'm not arguing that people have behaved rightly or wrongly when they end pregnancies or decide not to proceed. I'm just saying, in a world where we're non-directive, and we have these strong feelings about neurologically based cognitive capacities and traits, we may need to rethink what it is we say or what it is we want people to hear or what breadth of information we want them to reckon with before we just give them the results of their tests. So let me stop there and see if we've got any questions or comments. Yeah.
So your statistics about the 90 and 93% termination, I felt, it's kind of question and comment, is kind of biased because how many women are actually getting tested, and aren't they already more prone to considering terminating the pregnancy if they're getting tested to begin with?
Yeah, only about, of the over 35s, only about 10% of women in America don't get a test. So it is 90% of that 90%, but it's not a big number that don't seek out testing. And that, by the way, is interesting to me because there's no law, nobody put a fiscal incentive on the table. That's all cultural. What mom wouldn't get tested? How many people have been at a party or a discussion somewhere where people say, oh, I'm an older mom and I'm pregnant, and somebody doesn't pipe up and say, have you gotten a test for Down? It happens to me all the time, but that's just the kind of people I hang out with. But I think it happens a lot. I think there's a lot of pressure to do it. I see it on soap operas, TV shows. It was like, who wouldn't do that? It's got a little bit of the Chinese communist village you know, we're going to out the person who had a second baby or the person who's a political deviant, you better think about that if you're over 35. So that's where that came from, and I think it's penetrated the culture pretty strongly here. So most women do it older, and that's who most of these were. Yeah, that's another source, yeah. Yeah. So other pressures, yeah. So again, we may want to watch as we expand into the more neurological conditions, not just ataxias, but also behavioral. What message are we sending from the payers? What messages are we sending on the media about all this? Again, I'm not trying to stand in judgment, and I'm not trying to duck the issue. I just think we could give people more broader information than we do without getting into the directive side of this.
I guess one of the issues is that children with Down syndrome who live long enough almost invariably develop Alzheimer's.
Yes.
And you know they have an Alzheimer's risk gene on chromosome 21. So, are people being counseled about that as a risk, as they should be?
I don't know. I don't know the answer to that.
It's almost invariable.
My hunch is no, but I don't really know. I don't know what that discussion looks like. They're certainly not being told that on, let's call it, the Downs syndrome pages. You don't see that. You don't see it there.
So I come from a community where most Down syndromes are not terminated, and most people deny any screening. And I don't think cell-free fetal DNA is a new ethical issue that was not with nuchal fold, with nasal bone, with every single analyte that people had 80% accuracy or 90. It's just a better test now. And
earlier.
And earlier, sometimes. You can do CVS at 10, 11 weeks. People choose to terminate Down syndrome for whatever reason, and differences in countries or cultures, depending if they religious or ethically or whatever they choose. But I think this Rite Aid story is just a publicity stunt for Rite Aid and for the Alzheimer's Disease Association. I don't think that's has anything. You can't order a genetic test. Even a genetic counselor can't order a genetic test in most states. It's a doctor. So I don't think anytime soon we're going to have testing for neurological disorders at Rite Aid with the pharmacist being the one who orders it.
I'll disagree on that one. I think CVS, Rite Aid, big pharmaceutical chains are very interested in moving into the primary care business. I think they will want to have a nurse, they'll never get doctors, there aren't enough of them, or a physician's assistant, and I think you'll see them start to push for some of this 23andMe style testing. I think that's coming. HIV testing has been there. I think you'll see more.
HIV is more of a yes or a no versus almost every disease on that list is more of predictive.
But if you think of Decode, Navigenomics, 23andMe, not really big on counseling. Not big on counseling. And if you said, I've got a nurse or someone here who can at least administer it, certified labs, let us enter the thing. Plus, this kind of cell-free DNA testing has become the standard on any pregnant woman anyway. It's like blood pressure. Let's use it. So I don't know. I mean, we'll see, but I'm betting the push will go.
So Navigenics is off, Decode is down. The only one left is 23andMe that cannot offer it anyway, so.
And I will confess I've spent a fair amount of time trying to kill them all, but that's a separate issue. I'm going to lose that, is my grim prediction.
My question concerns the rate of abortions following the prenatal diagnosis of Down syndrome. Is it in the literature whether anyone has looked at the rate of abortions following prenatal diagnosis of other conditions such as cystic fibrosis, sickle cell anemia, and as to whether the availability of genetic testing for those conditions has altered the birth rate?
The only other one I know about that I can answer is spina bifida. Very big. Not as big as that, but big.
If it's helpful to look at extremes, if people didn't read the New England Journal of Medicine case CPC from last week of a baby that was born to a Jewish mother and an Irish, I think, father with Tay-Sachs. And when you look at that extreme and you think really prenatal testing is helpful, I think it can be, we can start asking about each condition, whether it's ethical or not. But if you really have good genetic testing that could have prevented Sandy Hook, because antisocial that would kill can be prevented, I don't know that I would vote against prenatal testing for that. So we can be, sure you don't want people to start aborting for everything, but it's not just genetic testing. There's cleft lip and cleft palate that in Israel people abort for.
By the way, there are plenty of places Japan tests for albinism.
Right. So
big stigma there.
So, but I think those tests are valuable and are helpful, and I think that if you want to try to change what's going on, it won't be by regulating genetic testing. I think that ship has sailed. It's by changing the way people think about things. I think if you would have you won't be able to do it now, but if you've tried to ask how many people would have aborted for homosexuality 20 years ago compared to today, you'll see that you can change public opinion about stuff. You can probably, more than anything regulated about Down syndrome, the TV show Glee with a Down syndrome actor has probably done more help to the Down Foundation than any of those advocacies about genetic counseling prior to getting testing.
So I agree with what you said at the end there in particular. I think it is going to be important as we move into this rapidly expanding area of neurological, psychological, mental health type states, capacities, abilities to really try to see what the culture's attitudes are, try to take steps as healthcare organizations to broaden people's views, to give them the full picture of what people with differences can do. I'm sure that billboard that the woman put up with the Down syndrome baby she's trying that. She's trying to do what you're talking about. And I think it's important. Again, I'm not ready to jump in here and say, I would restrict your right to end your pregnancy, for whatever reason. I'm not. But I am ready to rethink if we're not going to be directive, although as I said to you, I think some people are going to be doing genetic testing soon, are really directive. I mean, just to remind you, when I go to the doctor, if I showed up with blood pressure 190 over 130, and I said, yeah, I don't really care, my choice. That's how it's going to be, I'd be getting pushed against the wall, beaten with a stick. Somebody's going to be forcing statins down my throat. I mean, that's not going to happen. That world's very directive. This world is moving toward that world. Whether non-directivity is what we want to take as a stance relative to where I think we're headed, I think that's not wise. Some of the things you're talking about, I think, would need to supplement where we're going.
Hi. If I could go back to the first case that you presented, I think you presented a very clear picture of the father's motivation and his approach, although some of that might just be my imagination. I was wondering if you had any sense both of what the daughter had to say and also, how she said it.
Daughter said nothing. Didn't talk very much. Seemed to be really under the dad's thumb.
She was always in the room? And did anyone consult with her separately?
Very tough to get her alone. Very tough. I didn't. I never succeeded.
Do you know if anyone was? Okay.
I don't know. Yeah, yes. But we thought we'd settled it because we sort of said no, and here's why, and he said okay, and then off he went. He found someplace else. That was our...
How did you find out?
Student that I had wound up, and he said, remember Mr. X? He was here, and I know they did this. One of the great HIPAA violations. Well, thank you.